The big board's still heading south, 26 points lower, 11,465. Last week, the FDA said it will revoke approval of the drug Avastin to treat breast cancer. European regulators are still giving it the green light, however. Is this the beginning of healthcare rationing in America on a financial basis? Fox News medical contributor Dr. Marc Siegel joins the company today from Orlando, Florida, interrupting his Disney vacation just for us. Marc, you're a good man. Well, Doctor...
Good to see you, Stuart.
Look, Avastin has been withdrawn as a drug to treat breast cancer. Got it. But Avastin was wildly expensive. Depending on the dosage, I think it could run to tens of thousands of dollars per month and did not save lives. It prolonged and enhanced the quality of life. Are you saying that this revocation was because of money?
There's no question about this, Stuart. This is the beginning of rationing, the beginning of a collision of cultures with Obamacare coming up against our latest technologies, which is always expensive. And if you have end-stage breast cancer, you want any option you can get. This particular drug, Avastin, works in a way that no other drug works. It cuts off blood supply to the tumor. It's been found to be successful in colon, lung cancer, brain cancer, kidney cancer, very successful. And in breast cancer, it can give you 3 to 4 more months of disease-free interval. A study about whether it prolongs life is not the issue.
Got it. I mean, I think money is the issue. But couldn't you take the side of the government and say, look, we can't afford this? Well, I mean, somebody's got to pay. You want to prescribe that drug. Okay, somebody has got to pay tens of thousands of dollars per month. Now, who's going to pay?
Well, look, Stuart, you could make that argument, but that's what socialized medicine is all about. If you extend insurance laterally so everyone can use it every time they have a common cold, you're not going to be able to pay for drugs like this. That's the issue here. Then you're going to end up with a two-tiered system of medical care, where Stuart Varney, God forbid ever needs this drug, could pay out of pocket for it, or Marc Siegel. But someone that doesn't have that kind of money isn't going to get the treatment. That's where we're heading. We're going to be talking about this on the show here on many other drugs. Every time a drug is expensive, we call it an orphan drug if only certain groups of people benefit from it. Doctor, they're going to become obsolete.
Doctor, look, government resources are not infinite. I mean, the money is limited. Surely the government is doing the right thing in limiting its exposure to something as expensive as Avastin, which is tens of thousands of dollars a month.
Well, Stuart, I don't think the government has a role here at all. I think when the government steps in and sets up these regulations, it tells insurers not to cover this drug. It's going to squash private industry here. That's really the issue.
Well, would you be happy if it was a private sector insurance company that said, no, we can't afford it, we're not paying? Would you be happier?
I wouldn't be happy, but then it would be on a one-by-one basis. The government has no right in this situation because the drug hasn't been proven harmful. It's been proven helpful. They should stick to drugs that are proven harmful. When they start making this kind of decision, they're making quality of care decisions, and then I, as a doctor, don't have an arrow in my quiver that I need to treat patients. They're overstepping their bounds.
Okay, look, it's a very interesting subject, and we're going to have to return to this. Dr. Marc Siegel, thanks for interrupting that vacation. It's a very important subject. Come and see us again soon when you come back.
Thanks for playing devil's advocate, Stuart.
Okay, we'll discuss this, Doctor. We'll discuss it. Thanks a lot, sir. The highlight reel is next.